Loumiet. I'm the Managing Director at Uber Operations. Welcome to Uber University Unedited. Today with me I have Julie and Dr. Delgado, two instructors of Uber University. To get going, Julie, would you share with us a little bit of your background?
Sure. I'm Julie Meadows-Keefe. I'm an attorney. I've been practicing in Florida since 1993 in a variety of settings. Got interested in public health and worked as an attorney at the state health department, where I was in charge of, among other things, HIPAA privacy and security for a large state health department. I'm now out in the private sector assisting practitioners and providers and healthcare organizations comply with various laws and regulations. And I'm excited about this opportunity with Uber University to provide education to professionals and organizations and even to patients, because most people that I know in this industry are hungry for education and information delivered in bite-sized pieces that they can digest at their leisure and understand, and then move on to the next concept.
Excellent. Dr. Delgado?
Okay, well, I'm the owner and CEO of Taino Consultants. We opened our doors in 1995 when I got out of the military. And from the standpoint that I opened the doors, everything was about helping healthcare professionals and organizations. I actually own a community mental health center, multi-specialty practice, concierge medicine, rehab programs, a little bit of everything I've done, and I keep my hands on that. But at the same time, because we live in such exciting times, the technology is new, the laws are new, the way we even reach out to the patients is new. The patient's educational level and needs are different. So that creates an environment that we have never seen before. So it's just an opportunity. My goal always is, and this is why I put the name of Taino, is to help others. Because the Tainos were Native American in Puerto Rico, and they pretty much extinct because people were digging for gold. Nobody was there. So with your university, with Taino Consultants, we want to help those healthcare professionals to understand the environment, survive, and actually thrive on that.
Thank you very much. Recently, we've been hearing a lot about Obamacare or the Affordable Care Act. Julie, can you share a little bit about your thoughts on the Affordable Care Act and how that impacts the healthcare industry overall?
Well, the healthcare industry is going to experience a sea change under the Affordable Care Act. And as we're sitting here today, there's still issues going on at the federal level on the implementation of the Affordable Care Act. But we know there's been health insurance exchanges set up all over the country to assist folks in shopping for insurance. And we also know that there's been technical glitches with those computer systems. But overall, healthcare is going to be reaching more people than has been the case in the past. More people are going to be accessing care, and with all the great benefits that come along with that, there are also challenges for the providers who are going to be coping with an increased patient load, a patient demographic that they may be unfamiliar with, that may not have actually ever accessed healthcare before. So I feel as if the Affordable Care Act, coupled with the HIPAA high-tech changes, put providers in a position where they need to get up to speed on developments and also maintain their practices, which are their bread and butter living. So what I aspire to do is assist in that educational process where somebody at the end of their day with an hour to spare can learn about these concepts and how to implement them in their practice so that they can keep going and stay profitable.
Sure. Let me add a little bit to that, because I see same thing but from a different aspect, and I also see other things. For example, for the exchange, the products that they have come to us, and a product is when an insurance company comes in and say, we want you to sign on this plan. Right. Well, what I have seen, some of the products, they pay so low that we cannot accept them. So as we're looking at the exchange, and they're looking at all these millions of patients that are coming in, the problem is that I cannot tell you that we're going to be participating with those products. Right. So the patients will be there, the patient will have insurance, but it's not an insurance that I can touch or I want to touch. That's one thing that I see there. The other thing that I see also is that Nobody till now have mentioned anything about the Affordable Care Act and the compliance requirements of the Affordable Care Act. And this is coming from the Office of the Inspector General. The Office of the Inspector General have always wanted all healthcare professionals, organizations, providers to have a compliance plan. Yet, they have not been able to get it to be mandatory. So it always was recommended. It was always that if we inspect you and you have a compliance plan, we'll be nicer on you. But they didn't have that final punch. They tried to do it with HIPAA, but still they couldn't get it passed into law. With the Affordable Care Act now, the compliance requirement is mandatory. Most people don't even know because, to read that, it takes time, okay, to find all the little details. And even last night, I was doing some research, and I got reminded about the changes in the Affordable Care Act regarding the False Claims Act. They are significant. When you look at False Claims Act, and again, this law comes all the way back from the times of Abraham Lincoln, and how it has been evolving, and what is it now? I say, you gotta be careful because it changes the whole environment. So wake up. Affordable Care Act is not just about not having persistent conditions. Affordable Care Act is not just about this change. It covers a lot more. I would basically say it covers all my operations aspect, because from the marketing, who am I going to market, what patients, what procedures I'm going to do, because there are some procedures that are not going to be covered. So am I going to offer that? How am I going to reach to the patients? Again, I go back from the standpoint, it is the law. I'm not going to play that, but I need to know the rules. How do I play on this environment? And that's what I want to do. I want to tell everybody, the provider, the office manager, even the business associate, this is the law, this is how it applies to you, and this is what you got to be careful about. Now, no one is perfect. Even if we spend here years going through every single detail, there's going to be something that we miss, especially because it's new. There's not enough interpretation. So again, the fact that, okay, we're going to explain it to you now, that doesn't mean you understand it, because every time I read it, I find something new. You gotta keep up with it.
Well, on that note, how often should organizations, whether eligible providers, hospitals, medical centers, how often should they, even vendors, go through training?
Oh, Jesus, that's an ongoing thing for me. One of the things that I do, and one of the things I want to do with Uber University, is to develop courses, if possible, every month, because things are changing that fast. I was driving some policies and procedures. And this is funny because as soon as I finish, and I'm not talking 6 months, a year, I'm talking a week. When I finish, okay, I read the rule, I brought it down. By the time I finished, it was already obsolete, or not obsolete completely, but I had to modify it because it wasn't correct anymore, because now there's new guidelines. And that's the world where we live. There's constant guidelines coming out. So at the very least, if you are in a management position, and I'm talking management from a supervisor and all, at least monthly, there's something you have to keep reading, updating, finding out what's going on.
Okay, and lastly, one question, Julie. You've kind of alluded to the implementation of new technology, innovation, both at the state public health perspective and even in the private sector. As more and more organizations implement technology, they definitely can't forget HIPAA, right?
Correct.
Security and privacy, that's to be considered as they implement technology.
Absolutely. And some people assume that HIPAA compliance is actually built into a particular product
Right.
that they may purchase. Oh, well, I switched over to an EHR and it says that it's HIPAA compliant, and I take it out of the box and install it, and it's automatically HIPAA compliant. So you may be relying too much on the technology that you've purchased to the detriment of your HIPAA compliance program. So you need to know the intricacies of the product that you purchase. You need to find out if it says that it's HIPAA compliant, what does this mean? When was it last updated? Because standards get updated by the US government fairly frequently to adapt to different challenges that systems encounter. So don't assume that a package that you buy and install is going to take care of that for you within your organization, especially if you're starting to go towards electronic records. you need to be building a culture of compliance
Great. Excellent.
in your organization.
So I appreciate your time. I appreciate your time, Dr. Delgado, and I appreciate everyone who's been watching this video. For more information, please visit uberuniversity.com. There's an area where you can register for more news on upcoming courses from Julie and Dr. Delgado and our other instructors throughout the nation. We look forward to seeing you in the next Uber University Unedited. Thank you.